Senator Kim Pate, thanks for taking some time for us. We heard a little in Fraser's story about Tona Mills, but can you tell us about her and how you came to know her?
Sure. Well, Tona is now 52. I met her when she was 19, just coming into the system before she was in the federal system. She's a 60 scoop survivor. She had been in child welfare. She'd been in the youth system. She was in the adult system. And why we named Tona's Law after her is because she spent nearly, over 10 years in isolation in federal penitentiaries. As a result of that, she developed what was diagnosed by the psychiatrist in the mental health system in Nova Scotia as isolation-induced schizophrenia. And then it was about 11 years in that system before she was able to come out into the community. And when the Senate, I've been in touch with her over the years, saw her every few months. She knew my children. My kids are now grown up. And when we were doing the human rights study on the human rights of federally sentenced persons, we visited her in the psychiatric unit in the hospital where she was. And one of the things she said to me and the other three senators from our Human Rights Committee who were there was, she talked about what had happened to her, the horrific treatment she received at the hands of corrections, at the hands of even psychologists in the prison system, and asked us to please, if we could, pass a law. Well, we asked what we could do, and she said, please pass a law to stop this from ever happening to someone again. Well, around the same time, the government was deciding, as a result of some court cases challenging the use of segregation and solitary confinement, they brought in a new law in 2019, Bill C-83 it was called. It basically just renamed segregation, though, and took away some of the limited oversight, legal oversight that existed. And so with the late Senator Foray Singh, a Métis senator from here in Ontario, we worked on, a number of other senators as well, worked on amendments to that bill. And initially, even though the Senate voted on them and the government rejected a bunch of them, we voted to send it back. And basically, the long and the short is, in the end, the government did not adopt a number of the amendments. But Senator Foray Singh and I and a number of other senators started going into the prisons to monitor what was happening. At the same time, the correctional investigator was monitoring, and the ministerial advisory committee that was set up was monitoring. We all came to the same conclusion. Basically, what the government said they were going to do was not being done. Money that they had been given to contract with beds in mental health resources in provinces and territories had not been contracted. Mental health advocates from outside the prison system hadn't been hired. And the very oversight mechanisms they would put in place weren't being listened to. So the independent decision makers, their decisions weren't being followed. And so we worked on this legislation and decided to call it Tona's Law because of her request to us to end the use of segregation. And basically, it passed the Senate last night. This morning, Member of Parliament, our Métis senator from, our Métis member of Parliament from Edmonton, Griesbach, has taken it on, and hopefully it'll go through the House of Commons now. Tona, when I talked to her last night, she called me right after the vote. She was crying. She's dying. Actually, within a year, sadly, of being released from all of the systems, and for the first time in almost 3 decades being free in the community, she has now been diagnosed with terminal cancer. And so she's been told she has 6 to 9 months. Well, in September, she was told she has 6 to 9 months to live. And her wish is that this becomes law, so that before she dies, she knows that she had some small part in trying to help prevent what happened to her from happening to others. The bill, in addition to putting in oversight mechanisms, in addition to trying to deter corrections from using solitary confinement in all kinds of variations, regardless of what they call it, also requires them to actually look at some of the mechanisms that would allow people with mental health issues, as well as Indigenous people, to be released into their communities with supports to be held accountable in their communities. And so that's something that really should have been done back in 1992 when the law was first passed, but has really been interfered with and subverted by the way the government implemented those. So there are a number of provisions. It also provides a remedy where the way that corrections treats people amounts to them breaking the law themselves.
Senator Pate, we'll have to leave it there. Thank you for speaking with us on this.
Thank you very much, Creason, and thank you to APTN for all the incredible work you do, and happy holidays to everybody.